done with biometrics in the healthcare industry. So 15 minutes is very, very short, so I synthesize as much as I can. But the good news is that we've got a stand at the back. If you have questions, you can come and ask us. We'll answer to you with big pleasure. So biometrics in healthcare, positively identifying patients to ensure a great service delivery. So firstly, why is biometric use so crucial to the healthcare sector? Well, the answer is, let's find out. Before we start speaking about biometrics, I just would like to run through very, very quickly a definition and examples of what biometrics is. And in essence, biometrics is a means to identify somebody through a physical or a behavioral feature. There are many of them, and each of them has got different use case. So not one is better than the others, it just depends on what you want to do with them. So physical, obviously you've got the very well-known fingerprints. You also have facial recognition, iris recognition, voice, DNA, etc., etc. What is maybe a bit less known is the behavioral biometrics, which is your signature. Everybody knows how to sign, although you might not know that it's also some sort of biometrics. Keystroke, when you write, when you type on your keyboard, the gait, so basically the way you're moving, is also some type of biometrics, etc., etc. And if you're not happy with one of them, you can actually combine them in what we call a multimodal biometrics. So what is biometrics used for? So it's used for access control. South Africa is using it a lot. If you go to residential estates, you might see biometrics at the entrance, like big white box where you have to place your finger to come in. Piggybacked on the access control, you can use it for time and attendance. Forensic investigations, DNA and so on. Civil identity, that's your home affairs type of systems. And in the case of medical aid or healthcare industry, we will speak more about logical access control. So what you have to take into consideration is that in the past, when you were speaking about biometrics, we were speaking about security. And we were speaking about accuracy and performance and resistance to spoofing, because the last one is somebody to use a fake finger or any means to defraud your system. So that was the two main factors. Today things have changed. And now not only you have to look at the security part of it, but you also have to look at user-centric experience. And there are challenges to that. The first one is obviously data protection. Nobody out there wants to see or to know that their data has been tampered with or stolen from a system. Obviously you have to do that. The second one is convenience and ergonomics. If somebody has to learn how to use a biometric system, if it takes ages for them to understand how the system is working, they're not going to be very happy to use the system and they will reject it. Response time and throughput. You don't want to use the biometrics, which will actually be longer than what you were used to before in a normal system. Mobility, especially in South Africa and in Africa, you've got places where people cannot move, cannot get transportation easily to come to clinics or to come to doctors' offices. So basically mobility is key. You want to make sure that you can bring your system and your security to your patients. And obviously, very, very big hygiene. And especially when you've got an outbreak of Ebola or something like that, everybody starts thinking, well, what can I do to make sure that my hygiene is good? Or that I don't get sick because somebody else's hygiene or system was not hygienic. Practically speaking, how does it work? So the current situation, when there is no biometrics, well, you all know how it works. You use a membership number on a plastic card, and it's definitely not secure. So therefore, the card can be shared fraudulently. And it can be a public safety as well issue, because if I come with the card of one of my friends to get medication, the doctor looks at my medical record, and he thinks, well, everything is fine. I can give this patient penicillin, sorry. At the same time, I'm allergic or the other one is allergic to penicillin. You can kill someone in some extent. So it is a public safety issue. So why is biometric so crucial in the healthcare sector? Well, I'm going to give you the answer this time, or at least part of the answer. There are many more. But the main one is because it is the only way to uniquely and positively identify a member, the patient, or any stakeholder in the chain. And obviously, identifying somebody positively is paramount to ensuring great service delivery. I think we can all agree with that. So what are the benefits for the stakeholders? Obviously, the first stakeholders are the healthcare insurance and the governments. So for them, you can move towards a paperless workflow. You can increase the security, as I explained before. You can therefore reduce fraud and save money, which is the name of the game here. Benefits for healthcare professionals. It's convenient. It's improved patient care. They can have access to information securely that they didn't have before. Improved and secured authorization process. So basically, today, if I go to the pharmacy, the only way to prevent me from having medicines that I'm not supposed to have is the fact that the pharmacist is a professional, and if he doesn't have the right prescription, they won't give me the medicine. If you use a biometric system or an electronic system, you can actually check, authenticate transaction at every level. So when the doctor sees the patient, you can place the fingerprint to authorize the access to the medical file. When the prescription is loaded onto the card, for instance, you can make sure that the doctor authorizes it. And when the patient goes to the pharmacy, you can also ask the pharmacist, for instance, to place a fingerprint to authorize the transaction. So now you can actually have a full audit trail all along the system to make sure that nobody's going to come and say, no, but I never gave this prescription. It was not me. It can't be done with biometrics. And obviously the benefits for patients. Their privacy is respected, because if you have to place your fingerprint on a sensor to actually give access to your medical file, well, only those that you want can access this medical file. Improved medical care, I touched on it briefly. Basically, if you have access to my file, you make sure that I'm the right person with biometrics. You're not going to prescribe medicines to which I'm allergic. Time and cost savings. You don't have to, in some ways, depends on the system, but you don't have to travel to a remote location if you use biometrics, or at least biometrics as part of a mobile system. And it's very convenient as well. The only thing that the patient has to do is to place a finger or to show his face or something linked to biometrics. So how does it work? How do we enroll biometrics? Well, the first one is basically what everybody is doing today. You can capture the user's details and particulars and demographics, and your current system can be used for that. Then the fingerprint. Yeah, I'm speaking about fingerprint here, but that can be transposed to any type of biometrics. It's just that it's the most the widespread out there. You can enroll the fingerprint with a USB reader. Okay, I've just put a few different pictures of the type of biometric readers you can use. The biometric samples are converted into what we call a template. So for privacy as well, we don't necessarily keep the picture. And basically how it works, really in schematics, you've got four main phases. The first one is the acquisition and detection of what we call the minutiae, which are the points which are on your fingerprint, which is when two lines are crossing each other, when they are bifurcating from each other, and it's all the little piece of skin which are forming what we call the island. So from that, we go through two computer process to just get the points, to clean up and finalize the point and whatever information there is on the fingerprint. And the last step is to create the template, which in actual fact is what we call a binary file. Okay, so why do I show you that? Not to show that there is technology and that it's nice, but because there is another slide after that speaking about POPI, which is important. So the first point which is important to remember is that when you use a biometric system, you want to make sure that you've got that the technology you're using is certified for all the type of agency, regulation, government laws, and everything. So FBI, PIV, IQS certification, it's something which is recognized worldwide. And although you might say, well, we're in Africa here, so why would we care about FBI? Well, the fact of the matter is that it's a standard that's been developed in America, started in America by the FBI, but it's a standard that's been accepted in most places in the world. And in tenders out there, 99.9% of the time, the requirement is FBI, PIV, IQS certification, because it means something. It means quality, performances, and everything that goes with. Obviously, POPI and other privacy regulations, the systems that you need or that you want to select must be compliant with local regulation. So in South Africa, we're speaking about POPI. There are many points which are associated to POPI, but one of them is that when it comes to biometrics, you want to make sure that you don't have personal information, you don't keep personal information more than necessary or longer than necessary. So in a biometric system, for instance, you can, for forensic purposes, you can keep the picture, but you are not obliged to. So that's the process I showed you before. In actual fact, in this process, we go from one picture to a template, and the picture is discarded. With this template, you cannot reproduce the original picture. So you are ensuring the privacy of your user. And obviously, as you want to have a secure system, that you want to have a convenient system, you can actually adjust the level of security based on the need. So for instance, for basic information, you can just use a PIN code if you want. For confidential information, you might want to have the use of biometrics, which is mandatory. If you want something a bit more sensitive in terms of information, you might want to have multi-factor or multimodal biometrics. So basically, I might be placing my finger on a reader, but also I might be looking into a camera, and now I'm matched against my finger, but also against my face. Okay, so it's multimodal. Data and record keeping. Well, the good news is that biometrics is just an add-on to your system. So yes, it's an important add-on, but the fact of the matter is you can decide how you integrate biometrics. So you should be able to use most of the current communication infrastructure, as well as save the data in the locations that you want. All is required is to cater for the enrollment and decide on the matching process. Likewise, the patient medical file can be stored, can be saved on a server, on a device, on a card, on wherever you want, as long as obviously you've got adequate security for that. Data matching, so it's good to enroll people, but you need to be able to match them against a database of subscriber, member, or whatever population you want. And again, it depends on the infrastructure that you choose, so it's very flexible. You can have all the information on your central server and just send some query the server whenever you need the information. And that can be good. The only problem is it's infrastructure dependent. So it might be good for South Africa. Now, if you go into some countries in Africa, the level of infrastructure might not be as advanced as here, and therefore it might not be the best solution. You can match on a reader. So when you use your system, you can have something on the desk and you match on the reader itself. On a card, so the patient actually runs around with his own card, and all the personal information are stored on the card, encrypted, secured, and you can still, if you want, from time to time, match it against the server. But the information are basically on the card. Or on a cell phone, on a tablet, it's obviously taking more and more importance in today's life. And the other benefit as well is that when you use this type of system, you can have what we call duplicate search, which if you've got an existing database, you can make sure that in your database you don't have the same record, the same number multiple times based on different identities. And the other one is anti-duplicate search, which means that at the time of enrollment, before a new member is added, we will check if he's not already in the database based on his biometrics. When hygiene is a concern, you've got different measures that you can take, and it all depends on the type of environment you are in. The first one, which is the most logic, but it's not always possible, it's to clean the product with sanitized wipers. Okay. That you can do, but it's not always enough or possible. Or you can use contactless technology. So now you don't touch anything. You are actually swiping your hand. You are, okay, that's not contactless, that's the next point, sorry about that. It's when you make use of your own device. So you can use maybe the fingerprint sensor on your cell phone, okay? Or still on contactless, you can take a picture of your hand with your cell phone. Or if you use the face, you can actually look at your cell phone, take a selfie, turn your head to make sure that you are alive in front of the reader. It's not just a picture. And you can actually, identify yourself. All of that are concepts, are products, are bricks of the system that exist. I'm just giving you ideas here on how to use them. Or, why not actually integrating the biometric readers directly on the card of the member? So in this case, this one is used in the banking industry, but again, why not give the possibility to your member to actually have his own fingerprint readers with his cards? Mobility and added benefits. So I mentioned at the beginning of my presentation that sometimes in Africa, because we are in Africa, but it's the same in other parts of the world, it's not possible for the population, the remote population, to come to the main centers to get their medicine, to see a doctor, to do all of that. So why not offer them the added benefits of a mobile solution? You can use the system in the remote area. You can use it in 4G, 3G, GPRS, all the different type of network. Because if there is one thing which is pretty much present everywhere in the world, it's now GSM networks. So they might be at different level, but it is pretty much everywhere. You can link it to GPS. So now you want to make sure that the teams who are going to dispense the medicines are dispensing them at the right place. Because if you want them to dispense in, I don't know, in the middle of KZN, for instance, but they are in Limpopo, well, you've got a problem. So you can link the two together. And to go even further, the device should be able to replace a full computer. Because obviously, if you look at computers we had 20 years ago, or even 10 years ago, basically the tablets that we've got, even the cell phones that we've got today, are much more powerful than those devices at the time. So you can have a system which allows you to enroll remotely, to administrate remotely, and obviously you add biometrics to that to secure the whole transaction. The imagination is basically the limit. And that would be my last slide, but I think it's very, very important. I insist biometric is only one part of the system. If you think that biometrics is going to solve all your problems just because you get one biometric reader and put it on the table, well, think again. It has to be integrated in the system. It will help to secure and to identify uniquely and positively your members, but it still needs to be part of the system. So therefore, SDKs are available. I'm saying that because I'm speaking to a wide audience. But basically, if you are an end user, they are already out there service providers who are using biometrics. So you don't have to do it yourself. You don't have to develop yourself. If you need assistance in understanding how it works and what to do and how to do it, then all the help is available. Obviously, I'm here, but I mean, I'm not the only one. All I'm saying is that just whatever you need is whatever the system should be able to give you. And you shouldn't have to actually adapt to a system yourself. And that's my last comment. Thank you very much.
Thank you so much. I know we use your biometrics at my offices, so it really is really nice.
Thank you.
Except that part when you put your finger in and you feel that, you know, somebody didn't clean their fingers before, you know, like that post-lunch fingerprint thing.
Yes.
That's what irritates me. But I like the thing that you can like wave now, right?
So when you're ready, we can come and demonstrate the wave. Actually, it's there at the back.
Is it at the back? You guys have got a wonderful demonstration. So if you want to know where they are, if you walk in through here, out that entrance, they're just on the left-hand side, right?
That's correct.
Second floor. Thank you
Yes.
so much.
Thank you very much.
Very interesting.